president literally said this last night. He said, when you test, you have a case. When you test, you find something is wrong with people. If we didn't do any testing, we would have very few cases. I know you think that I am being hyperbolic and making fun of him, and I am making that up, but I am serious. He actually said exactly that.
When you test, you have a case. When you test, you find something is wrong with people. If we didn't do any testing, we would have very few cases.
If we didn't do any testing, we would have very few cases. No, actually, if we didn't do any testing, we would still have lots of cases. We just wouldn't know about them, which would be bad. If you happen to be a human being, or at least some kind of being that recognizes that people who get this thing are human beings, and human beings generally choose to avoid unnecessary suffering, illness, suffocation, pain, death, and mourning. If we didn't do any testing, we would have very few cases. That's the line from the president right now. That's the way we make our cases go away. We stop testing for them. That's the way we make houses stop burning down. We close the fire department. Then the data that says how many fires we've responded to goes to zero. We haven't had any fire responses at all. There's also no more houses left. The president went on to say today, quote, "It could be that testing, frankly, is overrated." Could that be because they cannot figure out how to get anybody outside the freaking White House tested on any regular basis? This is a terrible time for us to have a terrible government. I mean, both in the persona of the president who suggests, injecting bleach and that testing is the real problem and that viruses magically disappear and we don't need vaccines. It's a terrible time to have a terrible government in the persona of the president and in terms of what he can do to the rest of the government. And in terms of what he has done already to public health, to the CDC, you should see this editorial that ran today in the revered ancient British medical journal, the Lancet. It's called Reviving the U.S. CDC. Sometimes people outside our borders can see these things more clearly than we can. Quote, "The COVID-19 pandemic continues to worsen in the USA, prompting pointed new questions about the inconsistent and incoherent national response to the COVID-19 crisis there. The U.S. Centers for Disease Control, the flagship agency for the nation's public health, has seen its role minimized and become an ineffective and nominal advisor in the response to contain the spread of the virus. This is an agency that was once regarded as the gold standard for global disease detection and control. In the decades following its founding in 1946, the CDC became a national pillar of public health and globally respected. It trained cadres of applied epidemiologists to be deployed in the USA and abroad. CDC scientists have helped to discover new viruses and develop accurate tests for them. The Trump administration's erosion of the CDC will harm global cooperation in science and public health. A strong CDC is needed to respond to public health threats, both domestic and international, and to help prevent the next inevitable pandemic. The USA is still nowhere near able to provide the basic surveillance or laboratory testing infrastructure needed to combat the COVID-19 pandemic. The administration is obsessed with magic bullets, vaccines, new medicines, or a hope that the virus will simply disappear. But only a steadfast reliance on basic public health principles like test, trace, and isolate will see the emergency brought to an end. And this requires an effective national public health agency. The CDC needs a director who can provide leadership without the threat of being silenced and who has the technical capacity to lead today's complicated effort. Americans must put a president in the White House come January 2021 who will understand that public health should not be guided by partisan politics. When who is the president of the United States is one of the world's biggest public health crises. That's when you know these are very serious times. That's the Lancet today in a scathing editorial.